Everybody. The infectious COVID-19 virus is still incredibly infectious. We've gone from 618 to 875 people in the state of Connecticut who have tested positive. The breakdown is more or less similar to what we had before with the bulk in Fairfield County, and then moving up from New Haven and Hartford. London County has still been more spared. Number of hospitalized has gone up to 106. Number of fatalities has gone from 12 to 19. And again, the folks tend to be much older, over 75, over 80 years of age. The rate of infection is up, and we're not doing quite as many tests right now. We're still looking to do everything we can to make sure we have the reagents and other devices we need to make the test go, the PPEs, so that's slowed just a little bit. But we're doing everything we can to add capacity there, and we'll be able to announce, I hope.
Jake, FaceTime video.
Hey, this is for Jake. Who's he? He'll be right here. Mike, sorry about that. But we're doing everything we can to add capacity, and I think we're going to be able to add capacity in the testing front very soon. But the reagents and some of the things we need to do to evaluate those tests are in short supply. That's something we're working on as well. On the healthcare side, we do continue to do everything we can ourselves. We're looking over the horizon. We're hoping the cavalry's coming up from Washington, D.C. We added another field hospital today, Danbury Hospital, since it's our Fairfield County hospitals that tend to be by far the busiest right now. The good news is we still have a lot of capacity in our other hospitals. With less elective surgeries, that's creating some capacity for us. I've been impressed with the ingenuity of the people of Connecticut coming forward with amazing ideas on how they can help. Colin Cooper, our manufacturing czar, reached out to a parachute manufacturer and said, look, maybe you can provide some support for us in terms of designing protective gear. So coming up with the right specs, they're trying to come up with something that may be an intermediate help until the rest of the year comes up from the feds. Interesting, I recently went to the Litchfield Distillery where they used to make bourbon. They still make some bourbon, but now they're providing hand sanitizer. Free hand sanitizer if you want to go there, but bring your own bottle. The Mercy Free Dental Clinic has delivered a lot of PPE and other equipment to the Cheshire warehouse there. The Bethel Public Schools have delivered the same. So again, the people of Connecticut are stepping up. I've been sort of interested tracking the calls we get from 211, which is our emergency line. And I learned a lot about what's on people's minds there. And as you can imagine, you know, for the first week, most of the calls were related to COVID and what do I do? And is this social distancing really necessary? And what happens if I'm 40 and we say 90% of you just have the flu, and if you have COVID, 98% of you still are going to do fine? We gave a lot of that information, a lot of talk about the social distancing, which seems to be working, by the way, but based upon some evidence. We used to get a lot of rumors about, are you going to be closing roads? Are you going to be closing borders? And it's worth noting that Metro North is running at about 5% as opposed to 100% of capacity. Our ridership is down by about 95%. So a lot of people are quarantining themselves. And again, like to think that's indicative of the social distancing beginning to have an impact out there. I do some of the radio shows to explain to people what's going on. I always have to listen to the traffic report beforehand. And it's just sort of eerie to hear the traffic report say there are no cars on the road. And that is, again, indicative of the fact that I think people are taking the social distancing very seriously, and I can't urge you how important that is. Andrew Cuomo looked at Westchester County, looked at New Rochelle, and perhaps the rate of increase is beginning to slow there a little bit. And that's in part, in fact, thanks to very strict social distancing. Let me tell you where most of the calls from 211 are related to right now. Most of them are related to people's economic circumstance. Just terrified about where they're going to be. Folks who have lost all their income, folks who have lost a job, folks who saw their restaurants shut down, worried about unemployment, worried about business support. And that's what I'd like to talk about a little more today. Both what we're doing at the state level and a little bit what we can expect from the feds, because as you know, the Senate is about to pass their bill, reconcile with the House, and we'd like to think that there's going to be something soon on the horizon. I'm going to let our DECD Commissioner David Layman talk a little bit about our Connecticut Recovery Bridge. It's an amazing program. Look, our small businesses, the guy with a restaurant in Main Street in New Britain or a bar in Waterbury, they're not looking for a tax credit. They're not looking for a payroll tax deduction. You know, they don't have any income to pay these things or to pay payroll. What we're trying to do is make sure that they have enough cash to power through for the next 4 months plus. And David's going to tell you a little bit about the Forgivable loan program that we're putting in place. And it builds, or I like to think the federal plan will build on that. As you probably saw in the Senate bill right now, they have $350 billion allocated, not to tax credits, which don't help, but allocated, again, to forgivable loans. So I think we're paying special attention to those small business people wondering how they can keep people employed, how they can keep their doors open, how they can keep their lights on over the next 3, 4, 5 months. And we'll be able to talk about that. Look, more broadly, you get a little nervous, don't you, when Congress in less than a week comes up with a bill which is about $2 trillion in immediate relief. $2 trillion, by the way, is about half the total federal budget for the United States of America. It's about 10% of our overall economy. And for that to be agreed to in the dead of the night can make you a little nervous. But as we look at the bill and you see the scope of the problems confronting our state and confronting working families across our state and across this country, I think they've got it pretty right. What it means in terms of, for example, our hospitals. It's $100 billion for our hospitals. We're sorting through that right now. But as you know, our hospitals are racking up a lot of overtime. Their revenues are dramatically down for obvious reasons, and they're going to need support. $30 billion for education. You know, right now, UConn is going to be sending back some of the tuition payments, I'm told. And we got to do ways to help them power through this as well. And if you're wondering, these are federal numbers. And just for top line, assume that Connecticut gets about 1% of these federal numbers based upon per capita, where sometimes it should be based upon need. It's $150 billion in block grants to the states. You know, rather than just hand out money to people, the governors on both sides of the aisle, and I've said this before, felt very strongly that it came to prioritizing our needs. Let the governors take the lead there. And $150 billion, a minimum of $1.25 billion per state, which is a pretty good deal for Wyoming, by the way, which has about 1/7 as many people as Connecticut. But it gives us a little bit of flexibility to take care of the people we got to take care of, be it folks for the homeless, be it education, be it our other priorities going forward. And I'll just leave you with that thought that as I talked to our congressional delegation, and last night it was Senator Murphy and Senator Blumenthal really made the Senate bill, I think, a much better bill, gave us the flexibility, we governors on both sides of the aisle, to have the resources, hopefully sooner, that we can target, really taking care of small business in a way that is meaningful to them so they can power through. The only thing that worries me is when I hear this is money going by state or this is money going by municipality. And I mentioned on the Governors Association call today that this is a virus that knows no borders. And don't think about a municipality. Don't think about a state. Think about Southern Connecticut as part of the greater New York metropolitan area. And that's an area right now that is the epicenter of the COVID pandemic here in the United States of America. And unfortunately, we're on the edge of it, and Jersey City's on the edge of it, and New York City's right in the middle of it. And that's how I'm hoping that the federal government, as they allocate resources, not just per capita, but based upon need, where it makes the biggest difference. Look, for my friend Andrew Cuomo, he wants us to get the support and aid and PPE we need to help put out the fire in Fairfield County, just like I want him to get the aid in Westchester County, because it doesn't work to put out the fire in one part of the town and not the other part. You know, with that, I'd like to introduce David Layman, who I think you all know pretty well, to give you a little more detail about what we're doing to help small business.
Thank you, Governor. Good afternoon. So I want to talk a bit more about the Connecticut Recovery Bridge program. So this is a program that we announced initially last week on a call with over 5,000 businesses. And Deputy Commissioner Glenn Thames has really led the charge here at DECD with the team to get this in motion where we are. And there's also been really considerable support from legislative leadership on both sides of the aisle. So this was an effort really across many folks to get this to where we are right now, to be able to announce this program and provide specifics. So what is this program going to do? First and foremost, this is really targeted to small business. Eligible businesses here will be up to 100 employees, including sole practitioners, as well as not-for-profits, importantly. This program is going to offer 0% money, so no interest money, with an 18-month term. So businesses and not-for-profits will have a year and a half to pay the state back on these loans. The way we're going to think about sizing these loans is we're going to size them at 3 months of operating expenses for these businesses. So we want to make sure that businesses can have enough cash to meet their payroll, to meet their rent, to meet their insurance and other costs for this 3-month period as we battle the virus. We are going to cap the loan amount at $75,000. In the first tranche, the total amount that we're looking to do is $25 million. So that's going to be the high level. We intend to be out with a fact sheet later tonight or tomorrow morning. There will be a website. It's going to be a streamlined online application process that'll be up by tomorrow morning. DECD will work very closely with Connecticut Innovations on processing these applications and getting the money out on the street very quickly. But the real focus here is immediate liquidity and flexibility for our smallest businesses, because we realize how hard hit they are. And we anticipate these loans will be paid off when revenues come back, as the economy comes back to normal, or potentially by one of the federal loan programs that the governor mentioned, or by the private banks as more credit is extended to the small business community. So we think this will be a significant impact, near-term impact to small businesses in Connecticut, and more to come tonight on this, and we'll start taking applications and processing them tomorrow. Importantly, I want to talk about what's called the Paycheck Protection Program, and that is the $350 billion in the $2 trillion stimulus bill that is currently going through Congress. And this is very significant. So this is going to be eligible for businesses that are up to 500 people or classified as a small business under the SBA. And also in this program, if you're part of the gig economy or a sole practitioner, you'll also be able to apply for these loans. And these are the loans that the governor mentioned. These are loans that will become grants. So there's an 8-week compliance period, as we understand it, where if you maintain your payroll retroactive to February 15th, the loan will become a grant. And the way these loans are going to be sized, it will be 250% of one's monthly payroll to provide 2 months of payroll plus incremental amount of dollars to get folks through the next 2-month period with these loans. Importantly, these loans are going to be dispersed through private banks and other lenders that currently work with the SBA. So the federal government's going to utilize the full branch network and banking network that's in the state of Connecticut as well as other states to make sure these loans get out the door very, very quickly. So in terms of timeline, there's going to be a lot more to come. We still have questions that we've been talking to with our DC delegation, but it's important these loans come very, very quickly. And the size of these loans, if you use the governor's 1%, this is $3.5, potentially more billion dollars that will ultimately become a grant to benefit Connecticut small business. So I can't underscore enough how important this is going to be when this grant money aids our smallest businesses. Lastly, I was here a couple days ago and we talked a bit about essential and non-essential businesses. I really just want to make 2 main points on this just to underscore them. First and foremost, I spent a lot of time talking to employers that have essential operations in the state of Connecticut. And it's really important, really a twofold message here. For businesses that are essential, that they're non-critical employees, they need to be working from home. They need to be telecommuting or staying home. We understand that some portion of your employees are critical to the operations and need to be in the office for one reason or another. We want to make sure that incremental steps are taken as it relates to cleaning, social distancing, a moratorium on meetings, for example, following best practices by the CDC to make sure that your employees in the office are safe. And again, non-critical employees need to be working from home or staying home. In addition, I just want to say briefly a message to the employees out there that are working, whether they're manufacturing in factories, grocery stores, part of our supply chains. We just want to say thank you. We realize this is a time of anxiety given the fight against the virus. It is really appreciated, the critical work that is being done by those employees. We can't say thank you enough, and it's really important that the state and their employers do everything we can to make sure those employees are operating in a very safe work environment. That's it for me. I don't know if Dr. Carter, you're going to come up and make a few comments? No, okay. We're going to go to questions.
Okay, Governor, Senator Murphy tweeted today that one of Connecticut's busiest hospitals will run out of the testing kits in 3 days. If you're privy to that information, if you could share which hospital and what the plan is there. And then for Dr. Carter, with New York saying now they need 30,000 ventilators and them getting the supplies first because they're getting hit first, will there be anything left for us when the coronavirus peaks here in our state?
I would tell you, I have not heard those numbers, although I know some of our hospitals, especially in the southern part of the state, are getting stressed. I know they're being incredibly creative in terms of reusing, cleaning, disinfecting, getting the maximum out of what they've got. We have a big order in terms of a PPE and masks on order. As I've said a number of times, it's supposed to be arriving in the next 48 hours, but I'm now from the show me state. Dr. Carter?
Hi, I'm Dr. Matthew Carter. I'm the state epidemiologist with the Connecticut Department of Public Health. Let me take the ventilator question first. We have a whole team that's part of the state response and that's working on the ventilator issue. For example, looking at ventilators in the Connecticut, for example, there are ambulatory care surgical centers that have no longer a need for the ventilators that they use, at least right now, and they've been donated to the state. Orders are being put in for ventilators as well. Right now, every state in the country is trying to get as many ventilators as they can. I'm aware that the governor of New York yesterday proposed having ventilators come to New York City, and then when New York City was done, be moved to other parts of the country. I believe that was the thesis. To places where this has not yet impacted. I think that's part of the national strategy that still needs to be discussed, but there will probably never be enough ventilators. You probably read that there are now it's possible to have 2 people on a single ventilator. So there's a lot of people looking at this problem, and exactly how many ventilators we have when we'll hit the peak, we don't know yet.
How many do we have right now?
I don't have a number for you today, but I'm sure tomorrow we'll have a number for you.
Switch it up there, Dr. Carter just mentioned. When do you see us hitting the peak? Where are we on this virus? The governor mentioned yesterday that we're still climbing the escalator.
Oh, we are.
Where do you see us now, and when do you see us reaching a peak? And are we going to get 300 new or more positives every day going forward for a while?
Well, this is what we know. We know that the number of cases overall doubles every 3 to 5 days. And the number of cases that we see, the ones that are confirmed to be positive for COVID-19, are just the tip of the iceberg. And there are many more people in Connecticut that are infected, at this point thousands, than what we have in terms of confirmed cases. I've said before that we don't have a lot to draw on. We have a lot of experience with influenza pandemics, but we've never had a coronavirus pandemic. If we look at influenza pandemics, or just seasonal influenza, for example, about 10% of our population will come down with the flu between October and April every year. If we assume 10% of our population will get COVID-19 in the first wave, that's 350,000 people. Between now and the next 8 to 10 weeks will actually become sick with COVID-19. A small percentage of those people will require hospitalization, and another percentage of those will require treatment in an intensive care unit. So we are, it's impossible to predict exactly when the peak will occur. The expectation is that our social distancing efforts will have an impact. They've talked about a lot about flattening the curve. We'll spread that out. And so, for example, if we weren't doing anything, it might be 6 to 8 weeks. But if we put social distancing measures in and they work, but as has been done, maybe it'll be stretched out to 10 to 12 weeks before we see the peak. So this is really, at this point, uncharted territory for all of us. But that's the kind of thing we're looking at right now.
Question while Dr. Carter's up there. A lot of viewers have written in concerned about the ages of the deaths, and with the spike or jump in deaths, are you going to continue to release those, or they just want to kind of track it to see how it's tracking?
Well, the people most likely to die from this are people 65 years of age and greater. And then if you add on to that what's called comorbidities, other underlying illnesses, hypertension, for example, diabetes, the risk goes up. And so the risk really starts increasing at age 65 or thereabouts. It's higher in the 70s and higher in the 80s, and that's also reflected in deaths. They saw this in China, they're seeing this in Europe, and we're seeing this already in our state, where if you look at the people who are being tested, there are many people being tested in the 30, 40, 50-year range group. But if you look at hospitalizations and deaths, they tend to be much older, which is exactly what we have seen in other parts of the world.
Dr. Carter, we're getting concerns about delays in testing results. Just for clarity, how long should people be waiting for the results of their test, and what are we seeing right now in our state?
Okay. Well, first off, the testing situation is changing every day. The State Public Health Laboratory, which is the first lab in the state to be able to test, can run about 130 to 150 tests a day. We are the only lab in the state that can turn results around in a day. The other lab is the Yale New Haven lab, the virology lab at Yale New Haven Hospital, which can also turn things around quickly. The commercial laboratories like Quest and LabCorp, 4, 5, 6 days for those results. And that's why, for example, we're still doing all of the testing between us and Yale for all of the acute care hospitals, because that's where we need a rapid turnaround time. The drive-in clinics that you've seen are using the outpatient laboratories, so that's 4 to 6 days. There are also other smaller labs that are coming on board as well. So there is a range in terms of results getting back to patients. There's also a range in terms of laboratory results being reported to the state health department. Some laboratories can report to us electronically, others send us an Excel spreadsheet, and so there's data manipulation that has to go on there. So right now, it's a very fluid situation. There's also new tests that are becoming available. We talked about these a couple days ago. There's a test that can give results in about 45 minutes that can be run by many of our acute care hospitals. Unfortunately, they can only do about 4 or 5 specimens an hour, but it will give the hospitals the ability to get rapid results on certain patients and staff if they need to test somebody quickly. So it's a very evolving situation. Right now, all of the laboratories are dealing with issues related to supplies of reagents, running out of reagents or about to run out of reagents and just getting a new shipment in. And so every day we don't know exactly how much capacity we have for laboratory testing.
Governor, the Department of Labor right now, they have a 3-week backlog in processing unemployment claims. And a lot of these people who are service workers, there's a lot of data that indicates that many of them can't afford an unexpected expense of $400 or so. So what is the administration doing to beef up what's going on down at DOL? They said this morning that they've gone from 20 people processing these claims to 70, but that's still far short of what Connecticut was doing at the peak of the Great Recession, which was 130. So can you address that,
Kurt
please?
Westby, the commissioner, is redirecting people from all over DOL, getting folks who are involved in processing back into the game. This is just the surge before it hits our hospital beds has hit our unemployment claims. As you know, our computer system has peaked out on several times just because it capped out there. So we're going to do everything we can to make sure that speeds up, and I guarantee you he's not going to be denied any resources he needs to make sure our people are taken care of.
Does this expose a weakness in what the state had as far as the computer system and so forth?
Yes.
I think Josh is dying to say something about that.
Want me to keep going, Josh?
I think. So I'm Josh Jabal, Chief Operating Officer. I think it's worth pointing out that the Department of Labor is actually in the process of implementing a brand new system for unemployment insurance with a plan to go live around this time next year before this all hit. So there was a very well-known issue that we needed to upgrade our systems. That work is actually a year or two underway already. The timing of this is obviously unfortunate, but as the governor said, we're putting additional staff, we're putting additional resources, we're authorizing retirees to come back. We're pulling every lever we can to work through that backlog as quickly as possible. And we also have the additional layer of some additional benefits that could be coming through the federal bill, things we're doing in the state, which will add additional complexity that we're trying to get out in front of as well.
This is to get rid of the COBOL system? Sorry.
Yes, the project that's underway right now would sunset that old COBOL system with a new system that's part of a consortium with several other states that we're deep into the implementation process on already.
Two questions for the governor. Governor Ben Goldman with Fox 61. First of all, the state of Florida has issued a mandatory self-quarantine for those coming to Florida from Connecticut, New York, and New Jersey. In Connecticut, we see a lot of people coming from New York State, their second homes, whether it be in Litchfield County or down by the shoreline. Has there been any discussion about a mandatory quarantine for anyone coming to Connecticut from New York for 14 days?
Look, the good news is the highways are empty. Metro North is virtually empty. So this flood of people coming in and out, people are taking care of that. I think they're, quote, self-quarantining themselves right now. And so I'm going to push everything I can on a voluntary basis before I try and do anything on a mandatory basis.
And then secondly, we stood here yesterday talking about health insurance coverage for a lot of people that have been temporarily laid off or furloughed or laid off indefinitely. We got an email actually to our station from somebody watching who had a question for you. Her name is Lori, and she wrote that she's part of last week's temporary layoff due to COVID-19. She was told that her health insurance would expire April 1st, almost as devastating as losing a paycheck. Both of her kids are on her policy. She was offered Cobra and Husky, but she'd rather stay on her current policy because of what she's paid into it year to date with deductibles. This is an email coming from someone who wouldn't be in this position if her employer had offered a 60-day grace period to defer her health insurance premium payments. Yesterday, the commissioner of the Connecticut Insurance Department sent out a release asking insurance companies to allow that grace period, the 60-day grace period. It wasn't a mandate, it was simply an ask. I found out today at least 3 health insurance companies here in Connecticut are not adhering to her request, so they're still evaluating customers on a case-by-case basis. You know, these health insurance companies spend hundreds of millions of dollars to try to convince people that they're going to step in when times are tough, and right now, Governor, times are tough. Is there any talk about ordering or mandating these health insurance companies to extend a grace period? That way people like Lori
Yeah, I'm not
could
sure
have
that's
stayed covered?
working in the other states when you asked that question the other day. But I can tell you, you're right. We got the commissioner to start putting pressure on the health insurance companies, just like utilities, just like banks, just like landlords, just like the state of Connecticut, doing everything we can to defer this and allow people to work their way through the next 3 or 4 months. And believe me, I'm going to continue to push on this every day.
Apparently, it doesn't seem to be enough because these health insurance companies are still going on a case-by-case basis. Other than a mandate or an order, they don't have to follow the ask.
Well, I will ask, and we'll see what our other options are, and I'll probably do that in association with my fellow governors, which is the way I like to push on these things. But keep asking the question, because I hope insurance guys are watching.
Governor, I know that it's critical to get the PPE, the masks, the gloves to the healthcare professionals right now. What is happening with those supplies for state agencies, Department of Mental Health and Addiction Services, DCF, all of those other state workers? What is the plan? Because they are essential and they are staying in the workforce.
Yeah.
And yet they don't also have the equipment?
Renee Coleman Mitchell has prioritized hospitals, getting, I think, about 50% of the PPE. We got another load just came in yesterday. We're getting that distributed right now. And then, of course, first responders, nursing homes, and others will be sharing in whatever else we can. And everybody's been incredibly creative in making sure the PPE goes as far as it can.
I mean, but what about the state? I mean, the state agencies, are they getting any of these supplies?
Want to talk to that?
So the answer is yes. The state agencies have a share of the allocation, and we have a small committee that represents each of the different functional areas the governor just described, including state agencies, that as new shipments come in, we're looking at the need and we're getting them out to the areas of highest need. But, you know, look, we're aware that because of the shortages we have, there are many people out there right now that don't have either enough equipment or the enough supply to get through a longer period of time. And so that's why we're spending so much time right now scouring the globe, as the governor said, ordering aggressively. We've now got $10.9 million worth of orders in as of today for PPE. We're getting donations, as the governor mentioned. We're getting deliveries, albeit too small, from the national stockpile. So we've got a whole team that's working on nothing but this, recognizing that this is such a critical need in the state right now.
Are there, sorry, can I follow up? Okay. Are there still too many state employees in the workforce right now? I mean, I got a message back from your office saying that there's only 7,000 state employees working from home.
Yeah, so across the executive branch in particular, but really across all of state government, we are at places we've never been in terms of what a high percentage of our state workforce is working from home right now. And really tip my cap to so many of our commissioners, to our IT team that's enabled a lot of the technology to make this possible on pretty short notice. We think we do have some more where we can continue to work on this, but a lot of it is in response to new news that comes out. So, for example, as we announce what businesses are essential and need to stay open, there's a lot of activities in our state agencies that have to support those essential businesses, and so we have to work our way through what that means. But we're constantly looking at this. You know, I know in DAS, for example, we've got 88% of our workforce now working at least part of the time, if not all of the time, remotely. And many of the state agencies are in the same way. But as we've discussed, we have many state agencies that have to be on the job physically all the time, just based on the nature of their job. But I think our commissioners have done a great job of working through this and getting as many people home as they can overall.
Question for the governor. The White House last night, and I believe the governor of Florida, looking for self-imposed quarantines of 14 days for anyone traveling from New York. Whether by New York they include Metro New York, including Fairfield County. First of all, I would ask you if you have a view of how you interpret that. And second of all, what's your response to that? I understand that you're not recommending that the CDC guidelines don't recommend that. But do you have a comment about that call?
I think you're going to find that the coronavirus right now is focused in and around the greater New York metropolitan area, and the governor of Florida thinks it's a high-risk area, and that's why he made that recommendation. I think you're going to find that the people of Florida are going to have a high infection rate over the next couple of weeks as well, and maybe we'll be asking people to come up to Connecticut to self-quarantine as well.
Well, is that a response? Is that a political response, or are you saying because of public health? Because right now you're saying there's no public
I'm saying I think people should self-quarantine in Florida and in New York and in Connecticut. I think there should be a lot less travel because travel just tends to take the virus across borders. So I'm urging everybody in any of these states to stay close to home for the near term. Maybe Florida thinks they're a little more impervious right now, but they're not. So I'd urge everybody to stay close to home.
For Commissioner Layman, the $25 million, is that available, or is that something that there must be action for? And then, go ahead. I have a follow-up to that. Go ahead.
Just to your question relative to the $25 million, that is existing resources that we're deploying immediately.
Is that bonding money? Is that?
Those are principal and repayment interests from the Small Business Express program that was initiated in 2011, and so as we've gotten principal and repayment from that portfolio, we have a revolving loan fund, and so we're using funds from that particular program to do this initial round.
As far as the federal piece that David referenced, what's the significance of having it through private banks? There was some concerns raised to me by people who have dealt with the SBA, for example, saying that it can be very onerous. It can take 6 months. There's a lot of financials you have to put forward. So what's the advantage of having it go through banks, specifically as far as how fast the money might get to people?
Yeah, so listen, there is absolutely a sense of urgency that we have here in the state with the program we're doing, and that we believe we're seeing from the feds as well. The reason why they're using banks, and why I think it'll be quicker than a typical process, first and foremost, 100% of the risk is going to be guaranteed by the federal government in the $350 billion. And the SBA just doesn't have the capacity to get the money out to the businesses. The banks have the network, they have the client relationships, they have the ability to deploy that money. So the banks are effectively the arms that are going to be deploying the money on behalf of the Fed, and that's absolutely the way to do it efficiently.
And this one related thing. I don't know much about business interruption insurance, although I'm trying to learn. And apparently, if this had been a hurricane, there are a lot of restaurants that would be just fine right now. But why is it not covered in pandemic? And is this anything the state can look at? Is that another way to funnel money to companies that have business interruption?
So there is a carve-out in business interruption insurance for many things, including a pandemic or a virus. So the way those policies are priced, there's very specific risk that insurers are taking and that they're getting paid to take. The risk of a pandemic such as the one is not one of those. So that's why business interruption insurance is not kicking in. What I think you might see, though, on the heels of this, similar to what happened after 9/11, there was federal terrorism insurance. I think it's very possible that you see pandemic insurance, where the federal government is effectively a reinsurer of this for the private sector when this happens again. Hopefully it doesn't, but if it does.
Thank you.
Dr. Carter, quick question. The governor mentioned the other day that it seemed that people were possibly spending less time in the hospital here than had been seen elsewhere. Have you had a chance at all to study whether how long people have been in the hospital, who've been put in the hospital so far, and has anything about how the virus has hit us so far surprised you?
We have not. Our major focus right now is identifying confirmed cases and providing daily updates on case counts, hospitalizations, deaths. We have not done what you are talking about, because largely that would require a review of patient charts and records, which we are not in a position to do at this point in time. We're really focused on what's called the epidemiology of this disease. I think there was a second part to your question.
Has anything surprised you about how it's hit us so far?
We should be totally surprised by what's happening. Nothing like this has happened in 100 years. I mean, we have certain parallels to draw on, but this is something none of us have ever experienced.
Dr. Carter, I think you said within 8 weeks, if 10% of our population gets this, that's 350,000 people. Obviously, not all of them will be in the hospital, but what is the capacity of our hospitals? Do you know that number, and do you think we'll surpass that within 8 weeks?
Well, what I know is that every hospital in the state is working on trying to identify additional beds, either by discharging patients who can go to other facilities, by canceling elective surgery, by opening wings of the hospital that haven't been opened before, by identifying other places, by setting up mobile field hospitals to increase the number of beds. The reason why we're doing community mitigation is to try to keep hospitals from being overwhelmed. That will be the true measure. Right now, I think many of us are hopeful that we're starting to see some signs that we're slowing things down with social mitigation. The folks in New York certainly believe that they're seeing some effects. As I said a couple days ago, I expected to see more cases in New Haven and Hartford County. And it's still true that by and large they have not been inundated yet, which is very good news. And the eastern part of our state, while they have had some cases, is still largely unaffected. It would be wonderful if we could keep that for a while.
Does that put us behind the trajectory that you said 2.5 weeks ago, or maybe 2, of 10 to 20% this spring of the state? Are we now behind that?
Well, as I said 2 to 4 weeks ago, I don't have a crystal ball. I said on average in influenza season, 10 to 20% of the population comes down with influenza. Right now, for planning purposes, for COVID-19, we're using the number around 10% of the population will come down with the illness. Again, this is for planning purposes, and we're using those numbers to try to do those calculations that you just mentioned about how many people do we expect to be hospitalized, how many people will require intensive care unit treatment, how many people will need to be on ventilators. We're doing those calculations. They're doing them in New York City and in Massachusetts. I don't have the results of those models. I know the Connecticut Hospital Association is working on that, and a number of different modeling groups in Connecticut are also working on that to provide information to the state response.
So at this point, when you say there's a sense that the social distancing has worked or had some impact, you're talking about the number of cases in Hartford County, New Haven County, and Eastern Connecticut, is that right?
Slowing the spread, and also social distancing should decrease the total number of cases. Nobody knows by exactly how much for either one of those, but I know I'm talking longer than I probably should, but in brief, we do influenza modeling, but we have 30 years of influenza data to base those models on. We have 0 years of data to base COVID-19 modeling on. And so those models are still in development. Even the federal government hasn't released their modeling data. I'm providing you with my best estimates based on influenza.
Doctor, do we have those firm numbers, though, on the number of hospital beds that we have right now in the state and the capacity they're at right now?
I don't. That's a different team. That's part of the state response that's working on that.
We got that.
So in terms of overall health system capacity, we do have a team that includes representation from our hospitals, from our nursing homes, from our home health care, as well as all state emergency response functions that are contributing to our hospital surge planning right now. And so we are working a number of avenues. As has been mentioned, the hospitals are all working very hard and creatively on expanding their capacity. We're also looking at how we supplement that with additional resources, such as a number of nursing homes around the state that have been recently closed that we're inspecting right now and looking to potentially reopen to create overflow or step-down capacity for some of our acute care hospitals to free beds for patients who don't need acute care or recovering. We're looking, as the governor said, I think yesterday at the press conference, at a lot of other creative solutions, including we're emptying out the dorms of a lot of the state colleges and universities. We're looking at other facilities that we have access to. We won't be short on physical spaces. What the constraints will be much more related to the staff for those spaces and the supplies that we'll need to be able to meet that challenge. But we have a great team working on that. We're meeting multiple times a day in very close coordination with all the key stakeholders, and we'll be ready.
Like hard, firm numbers right now in terms of capacity, and then also the rooms?
We track daily the number of available beds in our healthcare system. Those other resources I mentioned, we haven't lit those up yet, other than the mobile field hospitals that have been deployed. We'll be in a position to share more data around that in the coming days.
People generally are supposed to be at home. I've heard a lot of questions from domestic violence advocates today. Why are gun stores considered essential? Why are they open?
I'm looking at this as a public health emergency, and we're going to do everything we can, including looking at gun stores, to make sure these are not places where people congregate and are likely to be able to transmit something that's highly, highly contagious. But we're looking every day at how we determine what stores stay open and what close. Let me just leave you with one thought. Look, I'm a sociology major, so I probably shouldn't say something not exactly along the lines of what Dr. Carter said. But you asked, what could we expect? I think you asked about this COVID virus, and the doctor said this is totally unexpected, it's brand new, nothing like this we've had before. We're learning every day. But I do say shame on us. We had an opportunity to look and get a heads up for what was going on in Wuhan province. We had a chance to look what was going on in South Korea and Hong Kong. We had a chance to look at what was going on right next door in our own country in Seattle. We had weeks and weeks of preparation to look a little bit into a crystal ball and prepare our response. I'd like to think that Connecticut did a pretty good job of looking at some of those telltale signals and getting ahead of the game. I'm pleased to see that at long last, I think the federal government is waking up as well, but we lost a couple of months, and that was very dangerous. Thank you, everybody.